In May 2018, at the 71st World Health Assembly, the Director General of World Health Organization, WHO, Dr. Tedros, issued a call to action to eliminate cervical cancer through widespread HPV vaccination, cervical screening, and early diagnosis within a few generations. And the official launch of the global strategy to accelerate the elimination of cervical cancer was on 17th November 2020, which was participated by all the nations enthusiastically. Breast cancer is -- in the mortality, and cervical cancer is #2 in the mortality rate. And if you see globally, India contributes to around, India stands second in globally for the cervical cancer death. Not many of them are right now also aware that screening is a compulsory thing. It's a must. We can achieve cervical cancer elimination by 2030. So this is the global strategy which has been developed by WHO. And what do you mean by elimination? Less than 4 women is suffering from cervical cancer in a given population, in 1 lakh given population at any time. So if this has to be achieved, what are we to do? So we do have tools like screening tools, which are user-friendly tools. EVA Mobile ODT. This is a screening tool which can be used by the paramedics to do the camps in the remote areas. And this is, connected very comfortably with through the cloud to the doctor who is analyzing all these, who is actually spearheading the projects. So this tool also has augmented itself with, artificial intelligence. So AI is one of the necessity these days, because the paramedics, QC and QA, that's quality control and quality assurance, is one of the important structure if you have to do a VIA-based screening programs. So the artificial intelligence enables the paramedics or the junior doctors or the healthcare people who have been doing the screening actually in the areas to analyze and interpret the results. So it comes up with normal, abnormal. So the risk stratification is there in a very comfortable manner. So that's one thing which EVA does, Mobile ODT does. And if we are able to identify those women who are screen positives, they are brought back to the center for colposcopic evaluation with a guided biopsy. And if these are taken up, guided biopsy shows CIN results, then it's very easy to treat them at the earliest stage. That's the beauty. That's what we call as preventive oncology. Let's contribute and let's make our India cervical cancer free. Thank you very much.
Ladies and gentlemen, as a CEO of a Braster company, I am honored to present you the Braster device. This is the result of over 10 years of hard work of the best Polish and probably the best in the world engineers, scientists, doctors and programmers. I am convinced that this device will change the rules of the game in the global female breast cancer prevention industry, and that Braster will improve existing healthcare systems worldwide. Thanks to our device, every woman, regardless of what country she lives in, rich or poor, on what continent and regardless of age, will be able to perform a simple, painless and safe preventive examination, enabling early detection of breast cancer if present. This exam is easy to perform and takes only 15 minutes. Thanks to advanced technology, algorithm used in our system and artificial intelligence involved, thermographic images of the breast obtained during the examination will be analyzed with the Braster telemedical system. and the result will be sent back in a short time to the doctor performing the examination if breast perversion is used, or to the woman performing the examination at home if breast system is used. In 2020, more than 2.2 million women worldwide developed breast cancer and 685,000 died from breast cancer. The numbers of cases is increasing year by year, even though breast cancer is now the most common cancer in 159 countries out of 185 countries included in the statistics of Globocom 2020 report, and is responsible for 1 in 4 cancer cases and 1 in 6 cancer deaths among women. Breast cancer does not have to be a fatal disease. When detected early, it is curable. This is why prophylaxis is so important. Braster has a solution that, if used in conjunction with the already existing methods, qualitatively improves the effectiveness of prophylaxis in the fight against the breast cancer pandemic. Remember, time matters. Be smart as Braster device. 15 minutes a month can save your life or the lives of those you care about. On behalf of Braster, I invite you to watch the movie. Tell them, the others, what you saw.
Breast cancer is the most frequently diagnosed malignant neoplasm in women. It is estimated that 47 Polish women are diagnosed with this cancer every day. However, there are ways to reduce the risk of breast cancer. The key to success here is prophylaxis, prophylaxis, and prophylaxis again. Regular examinations, including self-examination, are of paramount importance. There is a fairly common opinion that only older women and people with a family history of breast cancer develop breast cancer. However, our clinical observations, confirmed by epidemiological studies, show that increasingly younger women suffer from breast cancer. Hence, new methods of early detection of breast cancer, which were effective and at the same time easy to accept and apply by women, are constantly being searched for. These expectations are met by the work of Polish engineers, who developed the technology of liquid crystal matrices for detecting anomalies within the mammary glands. This method takes advantage of the phenomenon of elevated temperature within the neoplastic tumor compared to the surrounding tissues. The greatest benefit of this method, which has a chance to perfectly bridge the gap between breast self-examination and imaging examinations, will be achieved by women who undergo examinations at regular intervals.
$5.8 billion people around the world need better healthcare. And as a consequence of the lack of access to adequate healthcare, you have over 40 million lives lost due to cardiovascular disease, the world's #1 killer. The number of patients who have non-communicable disease, heart attacks and strokes are part of that, are over 283 million people. In India alone, 3 million lives are lost every year due to cardiovascular disease, making it India's #1 killer. And TRICOG is on a war to save these patients. One of the key driving factors for this large mortality rate for this one disease spectrum that uses the largest amount of healthcare budget spending across the world is this inadequacy in healthcare, both people and resources. And here is a WHO graph that explains where the healthcare resources, both, and here it is doctors. And as you can see, though the population exists across Asia, Africa, the number of doctors that are there are so small compared to the number in the West. As the number of patients are increasing, the number of doctors are very few to treat these patients. So how can you enable these doctors to treat and diagnose this large burden of disease? In India, and this will surprise you, is that the average time from the onset of chest pain to the time treatment is given, and this could be either an injection called streptokinase, which costs about 1,000 rupees, or a more expensive primary angioplasty, which costs a lakh of rupees, is approximately 400 minutes. This is a far cry from the 90 minutes of the golden hour. And all of you know that if you treat a patient with a heart attack in the golden hour, you can save lives. What you can see here in this graph is the steep slope as the steep slope of survival as the diagnosis is delayed further and further. If only we can diagnose people with heart attacks earlier on and ensure that they enter the care pathway, we can save millions of lives. The realization that I had after spending 15 years as an interventional cardiologist was the single factor that determines whether you will live or you will die was not money, but access to healthcare. I was one of the few privileged people, and so are you, who with a single phone call, our parents, our family will get the right healthcare. But the majority of the world, especially in India, do not have that same privilege. And that is the reason why TRICOG was started. What we did was the best and the highest quality care in the world is available today at the tertiary care. But can we shift the burden of diagnosis from the tertiary care down to the community level? And that is what we've done over the past 7 years. What we have built is a global AI-powered cardiac diagnosis network that enables real-time diagnosis for heart disease. So the spoke is where the device rests, the hub is where treatment is offered, and this is how we connect the spokes to the hub. Now, this is a very unique win-win-win model because at the primary or the community level, each doctor wants to offer his patients the highest quality diagnosis that you can get at a tertiary care level. Now it is available at your community doorstep. The hospitals and the cardiologists benefit because they are not only discovering patients, but they're enabling higher quality care to be delivered to their patients and hence saving lives. The governments, and we work with multiple governments across India, where we power this entire hub and spoke system for them in their network of hospitals. And finally, the people who benefit the most are the patients and their family. Earlier diagnosis leads to a higher survival, and of course, 1/10 the cost of treatment compared to late diagnosis. I'll give you a very quick example where early in the morning, a 40-year-old, a 45-year-old male goes to his local community hospital and this ECG is done. They get a call from the TRICOG service that says, hey, you have a serious problem on your hands. Treatment is started right away at this nursing home. He is then shifted to the closest city an hour away. An angioplasty is done. this young man's life is saved. And this story comes from a small hospital south of Bhopal, which is offering the highest quality diagnosis to all their patients. Every day, we see close to 10,000 of these stories where we enable doctors to take better care for their patients. Today, this small company situated in Bangalore is diagnoses over 3 to 4% of all cardiac patients across India. And as you can see, is that we've been able to spread ourselves to some of the most remote places in India. One of the key reasons to our success is our partnership with GenWorks that has enabled us to scale, where they bring the expertise of distribution run by professionals, reaching out to the smallest towns across India. And that is the reason why we've been able to scale so fast across the country. Today, I'm very proud that the team has helped and touched the lives of over 6 million patients. And out of them, close to 100,000 of them, critical heart attacks, where we have for sure helped in their survival. We do close to 200,000 to 250,000 patients every single month. And we have a large network now of close to 9,000 clinics, hospitals, and doctors who are using the TriCog service to save more lives. We started off with ECGs, and now we are in the process of launching remote cardiac ultrasound, a boon in our country, where ultrasound is again available at very high resource settings and not accessible to the common person. With the TriCog service, where an echo is done or a cardiac ultrasound is done remotely by a technician and uploaded, we can diagnose not just congenital heart diseases in children, valve diseases in younger adults, and finally, heart failure and aortic valve or degenerative valve diseases in the elderly at all points of time, enabling rapid diagnosis. And with the advent of point of care ultrasound, this is going to be a game changer for our country. We've built the entire tool set to enable remote interpretation of cardiac ultrasound or echocardiography, and AI is going to hasten the process of diagnosis. Finally, a very important aspect for TriCog is to be relevant throughout the patient's journey. At the interface between health and disease, we enable wearable devices to give you insight about your health. For screening, we have clinical grade devices such as the GE Max 600 and ultrasound devices that are able to screen for disease. And of course, the same tool sets are used within clinics and hospitals to enable faster and more accurate diagnosis. And finally, at the time of discharge, to ensure that the patient remains healthy and does not get readmitted, we have the entire remote patient monitoring platform to make sure that the restoration of health is prolonged. We started off our journey in India, and today the same set of tools and technologies being adopted with over 19 different countries around the world. TriCog's aim and admission is to enable technology and use technology to save lives. We've crossed the 6 million mark. We have 93 more million to go. Thank you very much for your time.